us that life is precious and it can go in a second, right? Can go in a second. And Mary Lynch was a very dear leader on the Assembly of Leaders of RNAO, and she will be remembered for her graciousness, her compassion, her integrity, and her just honoring people always. And also remembering all the people that lost their lives to COVID and their families that have been left in anguish. And then bringing it to today, honoring the thousands of people across the world that are suffering at the hands of wars, whether it is in Syria to this day, whether it is in Yemen, that is a disgrace that we don't speak a lot about, and whether it is in, quite frankly, the Republic of Congo that has been at war, I don't know for how long, and we don't speak a lot, and whether it is the horrific, horrific news that we are all seeing in Ukraine, on the hands of a monster, because it's no other way to call it than a monster. I was reading this morning early about how badly people from Russia that live here feel, how ashamed they feel. And if any of our colleagues here are from Russia, I want to tell you on behalf of RNAO that being a Russian doesn't mean being a supporter of Putin atrocities, that in front of us, the family, at least of RNAO, please never feel ashamed, because you are not responsible for the atrocities that our leaders make. And that goes for whoever is the leader in whichever country. You know, yes, there are others that need to feel guilty, like oligarchs that maintain these people, or people in power that maintain these people, but not the people, you know, that are either sent to wars that they don't want to fight, quite frankly, many times, or that have escaped those countries and live trying to do a new life, and now you're suffering, whether you are from Ukraine or from Russia or from any other country that is at war. It just aches our hearts, and it aches my heart. I mean, it's just so preventable, right? It's just so preventable. It's just so unjust. If people just would learn to live in love, you know what I mean? And as one colleague said to me one day, sometimes we will never understand fully what drives some people to this level of war crimes, because they are war crimes. So maybe, Susan, before we even go into an agenda, we open it for people just to express their hearts. Because I know that if it's heavy in my heart, and I know it's heavy on yours, because we have spoken with my team, RNAO staff, it's heavy on many people's heart. You know, you cannot watch the news and not feel heavy in the heart. So maybe we just open it for, 10 minutes, just if people want to share anything, any thoughts, whether it's about COVID or about the wars or about Mary Lynch or about anything in our sore hearts, I would say.
Yeah, so you can always make your comments in the chat, or you could raise your hand and we can let you unmute your line and go ahead and speak and share your thoughts. And then we'll get into COVID specific updates and things later. So I see a hand raised. Karen, you can speak, and then Martha after Karen.
Can you hear me?
Yes.
Thank you. Thanks for doing this today. I really appreciate you doing this webinar and opening it up to us. I think I'm 63 years old. I've done this for over 40 years. I'm a respiratory coordinator. I'm very concerned about in the future being asked to go back to work to in-person or in-person only visits in a respiratory realm. With the current changes in legislature related to patients not having to mask, who may be unvaccinated on top of no longer needing masks and being asked to care for them. Obviously, my nursing part will do what I've always done, but I feel this recent legislature has put me and many of my fellow nurses into a vulnerable position.
So number one, Karen, I am glad we are taping, not because we will put it publicly, but we can use your quote with your permission without name, because you expressed it so eloquently, Karen. Tomorrow morning, I just asked Morgan if she can tomorrow morning do actually a CBC interview with Metro Morning. And it's exactly on this issue. And the reality is that you are in good company, in the sense that the great majority of not only nurses, but healthcare workers feel the way you feel. Morgan was sharing with me that she only lost 3 people, not nurses, 3 people in her nursing home because of the mandatory vaccination. But that the reality is that many stayed because it was mandatory. And by the way, her home, so I tip my hat again to our Morgan president, will maintain mandatory vaccination. I think, and I haven't had the chance to speak with our team, so let me just share now. But I did share with my grandkids before, and they gave me all kinds of ideas. So now I'm bringing half-cooked plan. So I want to, you remember when Victoria at RNAO and Susan, you and others, we developed the Maskathon. So I want to develop an idea of a prize for schools that most of the kids keep their masks on. And my middle grandson said, Safety, give money and tell the schools with the kids to vote on what will the money be used for. And I said, and what will that be, pizza? He says, Safety, maybe pizza, but no Safety. We need air conditioning, we need this. It was all about school infrastructure. Like, I was so touched, he's 11. I was so touched of how much he cared about helping the school to have better infrastructure. So I think we are on to something there. And maybe we can do the same for healthcare organizations, because my view, just from listening to what kids say, is that 60 to 70% of the kids want to keep the masks on. And I said that today in CBC in Radio Canada. Either it is because they want to keep it because they have a parent or a grandparent that is, older or immunocompromised, or they have a young sibling. They worry very much, the kids, about their young siblings, or because they just think it's the right thing to do. And I think if we can build on that positive, we will continue to push for government to do the right thing. And I will tell you why in a minute, based on science, I will tell you. But the reality is that will they change before elections? In my view, this was a completely political decision, not an evidence-based decision. So I doubt they will change. But let's show to the government that we can stand up to them with our feet, keeping the mask on, keeping the boosters, keeping the vaccination. So Karen, thank you. You're not alone on feeling that. And we need to write about that. So I would suggest that we will send you back the blurb that you just said, the comment, and you put it as a letter to the editor, Karen, with your name, and we can review it for you, because the public needs to know that healthcare professionals feel vulnerable health-wise by needing to take care of patients that are not, keeping the mask on, being vaccinated, and workers also. So thank you, Karen. Thank you.
Thank you.
And Martha, are you able to unmute your line? You've got permission to do so. You see you had your hand up a moment ago, or still do.
Okay, can you hear me now?
We
Yes.
can. Great,
Oh,
thank you.
good. Sorry, I am having trouble hearing everyone, but I'm hard of hearing. So, but I didn't hear everything that Karen said, but I gathered from what Doris said that a lot of nurses would feel what Karen feels, that throughout COVID, there has been a sense that the government says they have listened to the science and to the nurses and to the health professionals and to the people who really care about getting vaccinated, but that it's been politicized to a great degree, so that I think we've lost more lives as a result. I thank RNAO for all the letters that were put out that we could sign, because RNAO has an important platform and an important purpose, whereas individually, if we do write letters to the editor, I think that's fantastic, but that is an individual. I feel I don't have, a platform, so to speak. And it's good if you can come together in numbers to send the same message to the government, that the science and the health is important, and that I don't think enough has been done to protect seniors and staff in long-term care homes, to protect nurses in the hospital against people who refuse to get vaccinated or who do not, for some reason, want to understand the science behind COVID or how a virus spreads or how you protect yourself. Instead, they listen to the false information, the misinformation, the conspiracy theories. And I'd like to know for the future what we can do to change this. And I think education, starting with the education in the early grades around viruses and how they spread, the importance of vaccination, and so that they can help to educate their parents perhaps, but at least they will grow up to perhaps think differently from parents who don't believe in vaccinations, who don't believe in masking. And that would help us for the next pandemic, which I'm sure, unfortunately, will come sometime in the future.
Yeah, it will. First of all, we're not done with it, and I will give an update on that. Second of all, while it is true that RNAO has a unique platform and that we have also quite a bit of power to share our views, I think the views of individual colleagues vis-a-vis letters to the editor are critical, right? So that people don't think, oh, this is RNAO. No, this is individual nurses. This is individual people in the community. This is families of nurses that are saying the same type of messages, and they're super powerful. I want to again share that we can and will review and help you with letters to the editor. Susan or Imagine, I don't know if we have someone from comms. If someone from comms can put Marianne's email, and also I would suggest Madison or Victoria's email, so they can communicate with how to write a letter, or even here is the draft, can you help me? 150 words, guys, that's all that is needed. It needs to be in response to something in your newspaper or in whichever newspaper, and we will send you back. We will send, the only thing you need to remember is that if it was today in the newspaper, within 2, 3, 4 days max, you should respond, because after that they don't look, unless it's a weekly newspaper, and then yes, they do that. In smaller communities they take longer, but we will send it back to you within a matter of 24 to 48 hours with our feedback, and we will tell you even how to submit it. So let's make sure, Susan, that we communicate that to our comms people so they know that they should be expecting amazing pieces from our colleagues.
Sure, great, thank you. And Imogene put in the chat box, Madison and Victoria's contact and Marion's contact information as well.
Wonderful.
Yeah, thank you.
Any other comments in general about any of the aspects we have discussed? Anyone else?
And Raul does have his hand up, so maybe we can go to Raul next, and then anyone else, you can put your hand up or put a note in the chat.
Yes, thank you, Susan, and hi, everyone. Well, first of all, I want to say hello to all the parents who have their kids in the March break this week. And this morning, I was heartbroken to read this article from the Globe and Mail regarding domestic violence in Canada. And reading the article, it brought to me, well, what I heard that it happened during COVID-19, right? That it exacerbated the problem all over the world, but also in Canada. I was also checking the RNAO has excellent resources regarding this issue. I thought that maybe it was appropriate to mention it since we are talking about different struggles and issues with COVID-19. It's unfortunately something that is still happening here. Thank you.
Thank you, Raul. Raul, you may want to introduce yourself, just in case people don't know you.
Okay, so I'm going video just to say hello. Hi, everyone. My name is Raul Pinto. I'm a media content producer here at RNAO, and I'm very, very happy to be in these webinars because they're really teachable. And also, I'm very happy to see how many people turn out to be here, Doris. I know you're going to say it at some point, but almost 100 people, and that makes me very happy.
Very good. Very good. Very good. Any other comments, or we want to do the exercise?
I just wondered if, Imogene, if you might want to speak about your comment in the chat box that you said about what you read today or heard today.
Oh, yes, I will. I read in this publication that we get, Queen's Park Briefing, that in a press conference, the Premier said, what I've added here, he says, let me be very clear to the school boards, they aren't medical experts.
I know that was last week.
Is the expert.
So that was last week, Imogene.
Yeah, but
very unfortunate.
He is saying that the expectation is that the school boards follow the advice of the medical officer. So I agree with Doris. Anything we can do to change that perspective, we need to try.
And the thing, Imogene, is that I think some are challenging that anyways.
Yes.
And I don't think this is going to go away anytime soon. You know what I mean?
Yeah.
Especially that the positivity is going up. So, you know, things are not, we are going to see again a increase in numbers. That doesn't, so I will give that on the update more, but yeah. So, I mean, it's very unfortunate, those comments. Now, I didn't hear directly those comments. So sometimes, you know, they're taken out of context. So I want to be careful with that. But it would be great if we can find the tape where he said that, because then we actually don't repeat, you know, sometimes things, and I'm not excusing the Premier at all. I just want to make sure that if we repeat the same, there is a reference and then a video, and then we can actually use it, because that's totally uncalled for. Yeah. Especially that the science table was not consulted, as you know. Yeah, very unfortunate. Very unfortunate.
So I'm wondering at this time if maybe you want to provide some updates and just a couple of slides here on some recent events and what's, you know, some context about what's happening right now in the province. So just kind of leave it to you for an update and overview, please.
Yes, absolutely. Yes. So first of all, the test positivity is up again. It's going vertical up. And that is mainly because of the BA2, which is a subvariant of Omicron. it is not a more, it's a variant that spreads faster yet again. It's not more damaging. Well, I am saying what I have heard from scientists. You know that science can change, and in a month they can say something else, but that's science. It is spreading faster. People that already had COVID, some of you may be happy to know, are protected to it. So that's the good news. The vaccine also helps. And it doesn't appear from what was today in public that is taxing healthcare organizations, hospitals in particular, I'm talking. But the fact that China overnight is constructing a 6,000 bed, and you can see it live, by the way, it's just only China can do these things. Put it up, it's like Lego, huh? And it gets built. They are doing it already. They're closing cities already. China has been, as you know, very strict in not letting the virus spread. And it is unfortunate that we are dropping the masks and the mandatory vaccinations now. It is absolutely not good. It's also not good in the context of what's happening in Europe, not only in Ukraine, where people, the levels of vaccination were not, the highest. And then people were in close indoor places, as you know, right? And then they are going to other places that their vaccine rates may be in some places better, in some places even worse. And again, when you have refugees in enclosed places, I don't need to tell you what that means. So in any country that is at war, the several that I mentioned before, plus Ukraine now, nothing of that can help vis-a-vis COVID-19. And we forget sometimes, right? We forget that here we have it challenging, but in other places, just picture being in a war zone, and on top of that, right, being in a train, then jam-packed, and et cetera, et cetera. I think that while RNAO will continue to push for not dropping the masks and not dropping mandatory vaccination, I don't think we will see much change provincially or nationally. Some other jurisdictions like Saskatchewan is even worse. They have taken it from schools altogether. The masks now, in Alberta even before. BC, interestingly, kept the mask mandates in school on for schools. But I don't think you will see much changes from a policy perspective before next October, when we will see where they are. And we cannot predict. Listen, we cannot predict. Maybe we are fortunate, not lucky, but fortunate, and things have, at some point, they need to come down, right? So hopefully we are at that stage. And if not, we will have masks again in schools, because as you know, the classes is a lot of kids and the ventilation is not the strongest. It's better than what it was, silver lining, but not the strongest, etc. But I do think that we all nurses, we can serve as role models. That's, hey, another campaign, Susan. Let's serve as role models, we nurses, where we go to stores, where we talk with families, both about the vaccination. So about if you haven't gotten the first or second, go please. If you haven't gotten the booster, go please. And then the mask in indoor places, all indoor places. It is still kept here in the public transportation, thankfully. But I think when you go to a store, when you go to any place that is public indoors, you should keep it on and get a good mask, get an N95. So I tweeted on the weekend, I tweeted also last week, but I tweeted on the weekend a really good, which I will try to find and send you, a really good a flyer, poster, whatever we call them, that it basically shows, so two things. In my blog, there is which went Friday. In my blog, there is a link to the article in The Lancet of why masks work. It's very good. But also I tweeted a diagram of if both people have a mask, if one person yes, the other no, etc., which is very good. I honestly don't remember who did it, but the logo is there. Someone said to me that, can we have one from WHO? Look, it doesn't matter who did a flyer. If the flyer is good, just use it. You know what I mean? Don't wait that others, we will find a gazillion others. So I will try to send it to you and use it because, yeah, it's important. It's important. Very good. So those are the updates. The updates are in relationship to Omicron. Is about the subvariant. It's not a new variant, but the subvariant is the fact that the test positivity is going up despite of what we are told. And that usually these are lag indicators anyways. And so if it will have an impact on, I hope that people do stay home when they're sick and that they're not just spreading it, but you know, some people need to go to work and they don't have with whom to leave the kid or to leave, you know what I mean? Life is life, right? It's not just that people are irresponsible. Life is life. Some people don't have the sick days, so that's important too, etc. So that's with the Omicron, and hospitalizations are going down. Let's hope that it keeps that way. And then that's in relationship to Omicron. Maybe I stop there and then we go to Ukraine and to the what we have done, what RNAO has done in Ukraine.
Thank you, Doris. I'm just looking at the chat and it looks like Eliza is from Italy and had some interesting things to say in the chat. I'm wondering, Eliza or Alyssa, if you might want to unmute your line and say a little bit more about what's happening in Italy. And also you say that you say in the chat box that you've had long COVID syndrome. So if you're interested, we can let you speak and share a little bit more. Also, I can just draw people's attention to the chat box there. So just giving you the opportunity to speak if you would like to, Eliza or Lisa. And just thanks to Raul and Heather for putting links to your tweets and to documents that you just mentioned in the chat. And Lydia also is, Lydia, I'm going to give you the opportunity to unmute your line as well, because you are actively posting in the chat too. And it's often interesting for everyone to hear your point of view verbally as well. So just give people a chance.
Hello, can you hear me?
Yes, we can.
Oh, I was just putting it in the chat. It's easier for me to express my ideas on the chat rather than to speak. I'm not much of a public speaker, but if you can, what I wrote, I can probably elaborate maybe, but sure, I'm pretty much direct. So the comments I put on the chat are very direct, and maybe other people can understand what my point of view is and maybe go somewhere with that. I wrote the UK is loosening their restrictions, and after 2 weeks, their infection rate has gone up. That is science right there. And I'm sorry, I'm a registered nurse from Seneca College, so I'm a diploma nurse. And then I got my degree learning about research. And I'm sorry, but you know what? I had, from my experience, you don't really need to do research to know what's going to go on, what's going to happen. You just know. So I don't think it's all like Doug Ford says, he's listening to the doctors. I don't think the doctors made these decisions.
No, they didn't.
So, and then I made a comment about, like the teachers are always in the news and they're like running the show. I never hear the nurses run the show. I go to RNAO meetings, I hear Doris speak. But where on the media do you hear nurses saying this is what must be done? And public health nurses, I know I went to school and they told me public health nurses do this, but do they have not even one commercial on the news? Nothing. Like, I don't know who funds this, but it's a disgrace to our profession. I don't know what else to say, but we need to
Very
make
well said, very well said, but I would encourage you to go to the website, and Irma Jean or Heather can put the link. We have over 10,000 or 15,000 by now interviews, and no, it's not only Doris, it's many members of RNAO, it's also many members of the Assembly. So while I appreciate your comments, that you hear me, trust me, many others have thousands and thousands of interviews, and that's why we are encouraging all of you to please continue to write letters to the editors. Letters to the editors are very important. They reach a lot of people, and again, we have all the help to support you do that. And I wouldn't say that teachers are getting more attention than nurses. Do we want more attention in nursing? Absolutely. Was the decision evidence-based? Not at all. But doctors will tell you the same, that the decision was not evidence-based. So I know we are all aching about that decision, and hence why the 95 people in this call, pen to pencil, 150 words is not difficult. And if you want to be, whether it's in television or radio, also send us your name, because we have so many requests and we are always trying to see people, especially that are local to that television or that radio, that can speak. So please, thank you for raising that, and let's keep increasing the power of nursing. And not because we need more power in nursing, but because we have remember, nursing is the highest trusted profession by the public, right? When you look at all the public polls, nursing is at the top, more than teachers, more than firefighters, more than anyone, let alone politicians, and don't even make it to the chart. Doesn't matter which party, they don't make it to the chart. So let's leverage the trust that the public has on nursing to really provide evidence-based information. Thanks hugely for the comment.
Great. I'm just going back to Eliza's or Alyssa's comment from Italy. I'm not sure if she's going to speak, but she said that a lot of nurses aren't vaccinated in Italy and that their national order suspended them. But now they're back at work because there are just no nurses to care on the front line. So those nurses have been reinstated. And then she's saying it said 187 people died today in Italy. So, you know, they've been ahead of us from the beginning. Yeah. So that's
well, because their wave comes before. And that's what I tweeted yesterday night. I tweeted, while Omicron next wave in Europe, it's there already. We in Canada, and I didn't say Ontario because it's all across Canada, are dropping public health measures. That's wrong, I said, and then I said keep the mask, etc., etc. That's the other piece where all of you could participate, whether it's Twitter, Facebook, etc. And I am aware that some employers have asked people not to do that, but this is a democratic country. If it's your gadget, you can do whatever you want. And if you get in trouble, you call us. Now, granted, you do not provide name of patients. You do not provide the name of your organization. You are respectful in how you express the views. You don't just blast without saying, you know, but if you are providing facts in a professional way, it only can increase your credibility and the credibility of the profession, and more importantly, push the issue. The reality is that BC, that had said 2 weeks ago that, and we were all kudos to BC, they actually had said that all regulated health professions was mandatory to get vaccinated by la date. They now dropped that too, and they only kept nurses and doctors. So at least they kept nurses and doctors, but it's in all sectors and all jurisdictions, all settings in BC. So yeah, the wave in Spain is increasing. In the US, not yet, but it will happen. I saw some of the scientists' predictions already. There was a very important another threat. So there is the threat on long COVID. There is the threat on the increases. There is the threat also on excess death, which we don't talk a lot. Excess death is about people that have died from conditions other than COVID because their treatments, etc., have been delayed by COVID, right? And that has been put, under the carpet by all governments across this country and everywhere in the world, more or less. And there is a very important thread by Tara Moriarty. Again, I can send it to you, that she explained. I mean, I took the hat to Tara over the weekend because it must have taken her easily 5 or 6 hours of work, even to write all those threads, because each one of them is based on evidence. Amazing, amazing thread to understand. So the issue with Twitter is that not only serves you to provide information that you want to provide or to provide your views, etc. It also can help you to really keep on top of the news. That's number one. I follow all the countries with whom we have BPSOs, not all the newspapers, but some, to know what's going on. And also it helps you keep on top of the science. Many of the top scientists are now tweeting way ahead. They have a paper submitted, right? Because once it's in Twitter, you cannot be just, someone cannot just take it and, say it's mine. It's in Twitter, it means, and we need to do those things because there is so much fake news to this day, so much fake news that we need to counter it with actual good news, meaning good news. I mean by that valid news, right? Yeah.
And Doris, to that, do you want to just, I know you have during these webinars before, but do you want to just name some of the top scientists that you recommend people keep an eye on or listen to through Twitter?
Yeah, absolutely, I can. So David Fisman here at home, of course, right? That goes without saying. Abdu here at home. Let me just get off a Twitter that I was starting to do before we started the thing, so I can give you. I was yet again saying keep the mask on and let Dr. Kieran Moore know that you're doing so. That was a nice tweet, but I am not ready to send it, so I'm going to delete it. I just don't want. Why don't you keep going and I will.
Sure.
Yeah.
That's fine. There's also a question. I think it's a really good question to ask from Martha. I mean, all of them are good questions, but Martha's asking, what can be done to protect all vulnerable people without a vaccine mandate or a mask mandate, yet ensure they have some freedom to go out or go to a restaurant without risk? And I think we're all looking at that balance. So Doris, do you have a response to that, or anyone else who's on the line today? What
in terms of the restaurants?
No, what can be done to protect all vulnerable people? If we're not having a vaccine mandate, we're not having a mask mandate, or the public health restrictions are lifting, how do we balance that freedom to go out? And
very simple. Keep masking and keep vaccinating. Keep masking and keep vaccinating. Now, if you were going to ask me if I am going to go to an indoors restaurant, I already have said to people that ask me to go with them, no, I will not. I will go to outside restaurants, absolutely, when the weather is better. Will I go to an inside restaurant? No, I'm not. I'm not. Period. Right? So, also be mindful of yourself, not just for yourself and for others that you live with. Right? Yeah. Yes, you keep going. I'm looking at these tweets to.
Sure. And thank you, Seppaline, for just reinforcing one of Doris's messages there, just saying, responding that nurses haven't been as vocal, but really saying that they have been in the mainstream news nightly, daily, weekly, and to check out social media sites.
And if you ask my staff, not just about me, but executive assembly, daily 10 times a day, not just daily, 10, 15 times a day, more than once. And it's not only on COVID. We have become the mecca for the media on whatever that they have questions, they come to RNAO. And we, again, try very much to put people from if it's local, from the local media, right? Like the other day, they wanted to talk about IENs, right? And we put them in touch with an IEN that we know is willing to speak, or they want to talk about shortages, or they want to talk about the mask, about a gazillion things. Anytime and every time we will put in touch people.
Yeah, and I strongly recommend that you follow RNAO and you follow Doris, and you'll be connected to all kinds of nurses who are speaking out very vocal, and other, reporters to follow, and other scientists to follow. So Karen Brooks is asking a question here. Based on the Ford video speak above, I think that's referring to what Ermagine had posted. Is my FHT allowed to keep a mask mandate in place? So I think that's family health team, maybe, allowed to keep a mask mandate in place for patients coming into the building or in-person healthcare provider visits. So I think that would apply to a lot of sectors. Just wondering, can they keep their own mask mandate?
Yes, you can. Yes, you can. And furthermore, if your workplace decides not to, that doesn't mean you cannot do it. And I would suggest that you do it. And I would suggest that you do it. Simply because, again, I think that Raul put that flyer that I was talking. Maybe you can open it for a minute, Susan, because it's a really good flyer to understand what the mask does.
Yeah. I'll stop sharing my screen and get that up in a minute, unless maybe we can have a team member, sorry, I'm scrolling inappropriately there. So just a team member pull that up for me. That'd be helpful. And while we're waiting for that, Doris, I'm wondering, do you recommend, sometimes it's helpful to have a one-liner, that you can say why you're using your mask that might compel other people to think twice. And they.
So I will tell you what I tweet all the time about that. I basically say, including for children, right? Let's start with children. To protect myself, to protect my loved ones, and to protect my community, right? It starts with yourself. It does protect you, but it protects others, especially if the two sides wear a mask.
And that's the image there.
It's an easy one, and it's an easy one to keep going with. Yeah, and
Raul just posted the tweet there, so you can
open that flyer. That flyer is, and take a picture, guys. Take a picture of it. It's fantastic. And remind me now who did it, because that doesn't come from RNAO, but it's amazing. It's just a very good flyer.
It is Nebraska Medicine, UNMC, Nebraska Medicine.
Okay, here you go. It's a good one. It's a good one. And it's simple, right? It's very, very, very simple, right? Any other ideas that people have of one-liners? Any one of you?
The risks of getting cardiovascular disease after getting COVID might encourage people to be more careful.
Yeah. Long COVID, more than one condition cardiovascular may not speak to everybody, but also to some, yes. But the issue of long COVID that we don't speak enough. And there are no good programs yet publicly covered for long COVID, you know, so that may, I think it's a mix of explaining to people and explaining with facts, and the long COVID is real, right? It's not everybody gets long COVID, but you know, a small percentage does. And if you are, and you never know when you will get the condition, whether it's this or other conditions, right? What the way your body will react.
We need to
Any
also
other?
define what long COVID is. It doesn't just mean that you have this long cough that lasts for a month. You
Mhm.
can have effects of having had the disease, and the risks of getting CHF in the future are more, you're more susceptible to be getting cardiovascular diseases. So people need to be careful about their weight, their smoking, all the risk factors, cholesterol, etc. I can't think of them all right now because I'm so upset. But there's a lot of health teaching that needs to be done.
Yeah. So meanwhile that people think of others, you were asking me about people that I would recommend as solid people in science. My top internationally is Eric Feige. Let me see if I can get a tweet from him. And so it's Dr. Eric Ding. Dr. Dr. Eric Ding. Raulito, maybe you can put that on the Twitter, his email. Dr. Eric Ding. There are several others, but you are not going to follow Gazillion, right? He will tell you about what's happening in the world with COVID and how like the increase in positivity from him. David Fishman also wrote about that, but Eric is even, you know, broader. On the issue of excess death, Tara Moriarty, Moriarty Lab is her thing. Now, if you follow me, just so you know, you will often see, like if you want to simplify your life and get the Reader Digest, just follow me because I will tweet whatever I find important from these individuals and you will spend less time, that's all. So Raul, you can put my Twitter there too. If you want to talk about I think those are my top priorities. I also like hugely. There are several others I like hugely, but Abdu, I know him by name, so here you go. Abdu Shawarki, and that is SHARKAWYMD. The beauty about Abdu that is different than some of the other two colleagues that I mentioned, he is less heavy on the science and more heavy on the kindness of how to say the science. So if you want the pure science, go to the others and they will say it as it is, no adornments. Abdu is more, is kinder on how he does it, but sometimes, you know, less strong on the science piece than the others. The others are pure scientists, right? And then there are many others, right? Many others. If you, so on that topic of COVID, I think those are my top priorities. And again, if you follow me, you will know. Oh.
I don't know what you mean by old Pinto.
Okay, I think that was just some background noise. And
if you want to, just 1 second more.
Sure.
Another person that that is incredible is Peter Hotez. So Peter is P-E-T-E-R Hotez, H-O-T-E-Z. And Peter developed a vaccine that is free of charge, that is under review for quite a long time now by WHO, that could provide the answer to the great majority of the world that still has not been vaccinated. Again, I do retweet Peter's, not all the time, but I do. I have been very fortunate that with all these people that I mentioned to you, for some reason or another, some that I know, but some I have not, like David, I know, but some like Hotes or Dr. Ding, I have no idea why, but they started to follow me, and then I became closer in terms of asking for advice, asking for questions, etc., and they respond beautifully. I think with Dr. Hotes is a shame that his vaccine has not been moved faster through the process. I am going to say something that he has not, so please do not say he said that, because he has not. I believe that a lot of that has to do with politics and big pharma, because when you give a vaccine that is for free, I don't need to tell you what does that to other vaccines potentially. It's not the first time in history that that would be the case. I was very close to Dr. Manuel Patarroyo in Colombia. And to make the story short, he ended up escaping the country and going and living for many years in Spain, because when he said to WHO that this vaccine against malaria will be free, actually he said will be 50 cents, half a dollar per vaccine, so that people in Africa could have the vaccine of malaria. Then of course the government at the time, this is decades ago, the government and the, quite frankly, mafia went after him, because again, he was threatening, right, the wealth of those that make money out of these things. I'm not saying that I am against the formal vaccines that have been so important, right? But I am saying that there is a big problem that countries have not demanded that those vaccines be that you know the protections of those vaccines in terms of the legal protections, that they be put in suspended for a while, so the world could be vaccinated at no cost, because no one has the money in many countries to pay for vaccines. So these things are complex. And always are complex. So in any case, that we might do some, maybe we will do a webinar one day with either Peter or Dr. Ding or David Fisman. It will be interesting to do a webinar with one of them, not all of them together, because that will be an inappropriate use of their time. That each one of them on their own right could do a whole webinar alone, right? So that's in relationship to this topic. In relationship to Ukraine, let me just, before I move to something else, I don't know how many of you have access to Al Jazeera, but I have said to my staff in more than one occasion, if you want to watch good news that provide the full picture of what's happening, Al Jazeera is absolutely outstanding. They also are outstanding at news in general, but now CBC has become stronger and stronger. At the beginning it didn't contain all the complexities of the situation, but yeah. And then there are some reporters that I follow on Twitter that I really trust their judgment and their openness to share. So depends on what's the topic, what you follow and who you follow, right?
Thanks, Doris. I just put Al Jazeera in the chat box too, in case
Fantastic.
you're not familiar with it. And Seppeline, I've invited you to unmute your line if you want to say a bit more about north-south travel and mask use. Could you speak to that point?
Can you hear me?
Yeah.
Yeah, this is This is phenomenal report because this is something I experienced myself. So this is not about what the news said or what the news.
That is
Yeah, I think we had 2 lines for you, Seppeline. So let's see about that one.
Okay, can you hear me now?
Yeah, we can. Yeah.
Yes. So I think
not good. Maybe we all should put our mics off, and maybe that will help.
So let's see what's happening. Oh, I don't know what's happening here.
Yeah, I think, Seppeline, you have 2 lines open, so you might need to close one, and then we'll try again.
Okay, let's see what happens here.
Excuse me, maybe Seppeline has the speaker too close to the mic. That's also an issue sometimes.
Okay. Maybe while we're letting that get sorted out, we'll go to Martha's question about public health. Doris, I think you probably want to speak to this. Martha asks, prior to COVID-19, Ford's government was planning to merge all of Ontario's public health units into 10 units. Public health has been extremely underfunded, as is the acute care sector, so for so many years. Do we know what the government is planning to do with regard to public health now? We need public health to protect the public, the 3 Ps of public health: prevention, protection, and promotion, health education, and so on.
Yeah, so the issue of the mergers of public health into less than the current number is not new. It's 2 decades old. There was 2 or 3 reports about that. So it crosses governments and it crosses parties, and it's not new. What's new is that there was COVID. That's what's new. And I think a thorough analysis will need to be done of how useful it was to have the 37 public health units versus going down to whatever it is that whoever is in government next time will want to do. And I think that what's critical is to separate the issue of funding from structure, right? What it will need to happen probably is that again, there will be some committee that will look at structure, etc. And they will look at how they performed in each one of the, because remember, some of them don't even have a medical officer of health, let alone a chief nurse, right? So I don't know. I'm sure there will be some type of review, and I'm sure that when that happens, we will be asked for our views again. What cannot change, if in any way, if it changes, needs to be vertical, up, not down, is the funding. If one thing is clear, regardless of the structures, is that the funding, the overall funding for public health cannot be decreased if nothing else needs to be increased, because of the 3 roles of public health, and because also we are not done with COVID. As much as the politicians want to present that we are done with COVID, COVID is not done with us. So it's irrelevant what we think about COVID. COVID is not done with us. So that role will continue and needs to be strong, so we are not caught by surprise. And the other roles need to be important too. But let me tell you, public health was not well utilized in the first wave of this pandemic and in the second wave, right? And I spoke at the time with many public health chief medical officers of health, local ones, that it was not enough involved, was not asked to be enough involved with nursing home situation. Instead of that, who came to the saving, so-called, right, was the hospitals. Well, should have been public health. And if you remember, Dr. Kieran Moore on those days was in charge of a public health unit, and he did fantastic because he actually tackled first the nursing homes. The first group that he gave the masks was to nursing homes. So, you know, here you go, a public health unit that did what needed to do. And the second piece is when you look at vaccination, public health at the beginning was kept out of the picture when every single year for the flu, who does the vaccination? Public health, primary care, and pharmacies. That's who does the flu vaccine. Not, yes, hospitals too, you know, in their entrance for people that come and it's easier for the workers, etc. But it's public health units that really keep it going, and primary care. And neither not public health nor primary care were well used at the outset of the pandemic, at least, even all the way to the third wave. Then yes, in later on, when all of us said, no, you don't need to have these big fridges and keep blah, blah, blah. You know, when people could not, or not scientists, but also even the science table at the beginning, but also government and those that attempted to run the vaccination plan, when they could not deny anymore what many of us were pushing, that yes, you can keep the vaccine. I don't remember the details, right? Needs to be, and that's when public health all of a sudden became, with the same vaccines, guys, became, oh, we can do it. And they did a marvelous job if you look at all these big centers, right?
Thanks for that response, Doris. So I think in just a minute, we'll try Cephaline again, because I think we might have sorted that out. And then I do want to go back to just reiterating these 3 questions that are on their screen and see if there are any more comments or questions you would like to make about what is on your mind as the province is opening up and public health measures are lifted. We have been talking about that, but if there's anything else that you want to ask or raise, what is going well? And what concerns do you have for your workplace, your families, and your communities? So just think if you have anything more that you would like to ask or say about those 3 questions. And in the time being, we'll go back to Cephaline to try one more time.
Hello, can you hear me?
We can, nice and clear.
Okay. Yeah, I think the whole issue with COVID-19 and now lifting the restrictions, I think it's all over the place, because we have global travel, and especially north-south travel. There is maskless people everywhere. Everywhere there is maskless people. So I think what maybe the scientists are not talking out enough. You know, the other group is getting more traction than the scientists, because maybe they think that we have enough people vaccinated, so we should be protected. So if some folks decide that mask or physical distancing or hand washing shouldn't happen again, which should have been done before COVID, I think this is the problem that we are going to have. So basically, right now, it's going to be luck that's going to keep us safe, because people are not wearing their masks. You know, the only place that I see masks is wearing is in the airport. They're mandating it, but people are still not using it anyway. So physical distancing is out the window. It's gone completely. And as I say, mask wearing is optional, very, very, very optional. So people are not wearing their masks. I see people coughing in their hands now, and they don't even put it to their elbow anymore. I've seen all sorts of things, and I'm just kind of thinking, oh my Lord. So right now, as much as we say a lot of things now, it's only luck is going to keep us safe now, really. And I'm serious about that.
Yeah.
Wondering about the comment earlier about the balance of freedom and masking, you know, and wondering, do we need to rebrand masking in some way at this phase in the pandemic when people are just so, you know, eager to get out into the world, and they're so, but the message of how masking helps, like, how do we rebrand that? Like, do we phrase it?
I actually deeply disagree with that.
Well, I'm glad.
Deeply, because I think what we need is to normalize masks. I don't think masks are this tragedy. And when we try to rebrand, in a way, we're saying it's not good to have it. When children are saying to me, tons of them, by the way, tons of them. We have no issue with that. You know, and then you have some that will say, oh, but we can't see their smile and da 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 da. You know what? Yes, we can. Yes, we can. I think, of course, right? It pushes you to be more expressive. That's all, right? And expressive in the words and etc. I mean, Imagine and I have been in China, and Heather, you too, many times, right? For work, not in a long time now, but they smile, they laugh, they're kind. You know what I mean? And many times that in all the public transit forever, way before our time, they use masks. And so I think sometimes we need to normalize things that may look like, you know, if not, we are saying, oh, if we need to rebrand, it means something is wrong about them. And I think everything is right about masks because they protect people and they protect the friends and the families and etc. So sorry,
I guess it's more the
Susan, can I say
messaging.
something about?
Please do. I'm glad I brought something up that's
well, it's good to bring something that is spiced up.
Can I say something about the rebranding?
Yeah.
Yeah, because you know what's happened is it's not an issue of rebranding. I think what we need to do is to remind all of us across the world that mask wearing, hand washing, and physical distancing is not new. So what we need to go back to is to remind people why we did those before COVID, because those issues are not new. I think people have taken it and attached it to COVID.
That's
so they're not washing their hands. That's not a COVID thing. That's an infection control thing. The same thing with mask wearing. It's not a COVID thing. It's an infection control thing, protecting others, physical distancing. So for instance, example, if you were sick before COVID, what you did was you said to your friend, if they invite you out, you says, oh, I'm not coming today, Susan or whoever. I'm coming down with something. And Susan said, okay, I'll see you when you're better. Okay, that's one. Mm-hmm. The other one was, if you had to go out, you wear a mask. You did. Mothers who had babies, when they had new babies, and sometimes the mothers due to immune, just the immune got, shattered with delivery, they get a flu or, runny nose. What we did, and mothers have to breastfeed, we tell the mothers wear a mask to protect the infant because the infant is right there and she's breathing on the infant. That's not new, right? Hand washing.
We need to tape this woman. We need to tape you. Oh, too bad I interrupted because she is taped.
It's not new. So this is what we have to go back to and remind.
Okay, Raulito interview for it. Yeah. So you know what first of all, thank you, Susan, for raising it because many, I'm sure, think that way outside of, in the street. And the reality is we are all sick and tired of it. We are all sick and tired of the whole thing, of the whole damn thing. This whole COVID thing. But this COVID thing is not tired with us somehow. Hopefully at some point we will beat it so much that we'll need to go away, right? But but I tell you one thing, I never used a mask before. So I want to say, it's not that when I went to China, I put the mask because I saw the others with the mask, or I think someone in the tweet, I think was you, Julia, said Japan. My son said the same about Japan. I have not, but I am not going never, even in 10 years, in a subway again without a mask. I'm not. That's it. Done. You know that, I don't know about you, but I have not had a cold for 2.5 years. My husband who used to have colds, right, left and center. Yes. It's the mask, guys. It's the mask. And the hand washing, that we became so hand washers, right? Come out of the subway, hand washing. How many times we used to say that the office guys before COVID, when you come, please wash your hands. And it was because of the flu. And I think people got a bit used, but that's it. Like, to me, it's now ingrained here. I think we never will have the problems the level of problems we had with flu like before COVID ever again. We will have, because people get back to their old ways of being, but not to the same level. I don't think so. So some good thing came out of this mess.
Yeah, I'm thinking about that Swiss cheese image, Doris.
Oh, it's amazing.
Yeah,
No?
yeah.
If you Google, imagine Swiss cheese, COVID Swiss cheese, you will get several of them. It's wonderful. Except I don't put it anymore in my tweets. You know why? Because it talks about lockdowns, and we are not recommending lockdowns. I think that really we don't need. And I think we will be blasted by the you know who, right? If we put that Swiss, that's the only reason I don't use the Swiss cheese anymore, but it was fantastic. It was fantastic.
I'm looking at some images now. It's easy to come up, and it's saying masks, distancing, cleaning, and disinfecting, hand washing. So a variety of different messages with that whole idea. Yeah. Thanks. Heather put that one up too. Yeah, great. So just asking people if they have any more comments or questions about these pulse check questions before we move on. Oh, Jane is writing masks. What was that? I just saw masks are the seat belts to keep people safe. Hopefully
That's
the
true.
Excellent.
That's true, but I can tell you,
yeah.
if my dear mother was alive today, and I wish she was, she will do with the mask what she did with the seatbelt, I'm afraid. So I will see her, right, when the seatbelts first came, and I would see that she put it, but she didn't click it there. So I go, Mamisita, please put the seatbelt on. She goes, oh, no, 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 they will think I have it on, the police, right? I'm afraid she will put the mask and then probably lower it. Maybe no, because of so much drilling that I will be doing about the mask. But you see that with the mask, you see the same. You see the people in the supermarket on when someone is watching or whatever, and then, or they go like this to talk with you as if you couldn't hear them. And you go, but it's exactly when you talk that you need to keep it up here.
Yeah, so a couple of comments I'd like to point out from the chat box. Naomi saying double mask. Would the message be a N95 mask? What do you, would we?
So first of all, the issue of double mask is tricky. What you need is one well-fitted mask, N95 or NK95. One well-fitted mask is what you need. One well-fitted KN95 is better than two less fitted, loose, whatever other mask. You know what I mean? Yes, they're a bit more expensive, but I think it was Heather that pointed it to me one day that they last longer. They last longer. And if you have three, you use one, then you let it there for 48 hours or whatever number of days, you use the second, and then you let it there, and then you use the third, and you can use them more, you know? I used to wear two masks. I used to. I don't anymore, because you can be putting it wrong also, right? Right? And the moment the finger goes in or half a finger, it means it's not well fitted. So
I'm glad we brought up this comment about the masks, because mask and hand washing is not the only thing that we need to look at. This is not a flu that we're fighting. We're fighting COVID. And what we are forgetting to mention is that COVID is airborne. And that's serious. It is airborne like TB. We have to wear an N95 mask if we're going to be in an elevator. I spray Lysol in the elevator because I'm so paranoid. I'm taking care of my mother who's 91 years old. I'm protecting myself so I can take care of my mother. If I didn't have my mother in my life, I might have taken off my mask and said the hell with it too. But I have to worry about people I have to take care of, and her life is important to me.
Yeah.
So COVID is airborne, and that's the problem about taking off the masks and going out into society, going to watch a movie at the Cineplex while all these COVID airborne particles are all over the place.
Yeah. And just for those of you that want to think elevators pitch about what our colleague just said is like cigarettes. If you are in another room and you can smell the cigarette, that's when things travel through the air. And the same is with these particles. If your mask, if you can, if you don't fit it well and you can smell the cigarette, it means your mask is not well fitted, and doesn't mean you need to go and have it well fitted. I do mine alone by tightening the loop, right? Just don't tighten it too much that it breaks, because that has happened to me too. The elastic breaks when you put it.
I think one of the themes that we're hearing today, and I'm reading in the chat box, is that people are losing track of the why or the rationale. And Martha is saying here, we just talked about like that lost piece about it being airborne.
Yeah.
And Martha's, saying in the chat box, just the rationale, the importance and the rationale, the why, because it's more like people are just thinking, oh, masks, and they forget, or the hand washing, they forget.
Exactly.
Like,
I like the comment about Naomi kind of told me that I'm outdated here. These days you smell a lot of marijuana in the community. Hi, indoor is not cigarettes. You're right. Yeah, I need to tell you, the first time that I smelled marijuana in the street, I didn't know what it was, right, years ago. I was not very much of a marijuana person growing up, but now I know how it smells. So yes, you're right. We smell more marijuana than cigarettes in the streets.
Okay.
I think we've talked around this. This is Seppeline, but I think if we put everything that everyone has said, I think we all headed in the same direction. I think we are on the same lane, wanting to have everybody healthy, and to remain healthy at this point, we need to have some sort of responsibility on everyone's part to make sure that everyone is safe. And what things do you use to make everyone safe? We talk about the mask, we talk about the hand washing, we talk about the physical distancing. Those are protocols that should have been in place a long time before COVID. We need to, how do we market those protocols minus COVID? That's what we need to do, because we will have to continue doing that even if COVID leaves tomorrow.
I don't think you can expect that from government, but we can role model to others.
Yeah, well, that's the thing. I have people tell me that they haven't had the flu for 2 years. And they said the only thing that has saved me from not having it, every year I have the flu, every year. And for 2 years, I haven't had the flu. And they said, this is research, guys. My mask, I can tell you that's the research. I've been wearing my mask and people have been wearing their masks, and I've been protected from people coughing and airborne things coming to me that my immunity can't deal with. So that's what's happening. So we have to sit back and think, how are we going to, as you Susan's word, rebrand that old protocol to let people know that helps us to keep us healthy. That's a public health thing that makes all of us healthy, irrespective of COVID. That's what we need to kind of grapple with right now.
For sure, Seppeline. There is a comment that is very common and very important also here, in addition, from Marianne. That's Marianne Bauman, that says, so many in the community feel just like get COVID and get it over with. Well, if you knew that everything will be easy, sure, get it over with. But by the way, you can get it again, depends on the strain. The next strain is not necessarily the same strain as before. So I wouldn't recommend to anyone to get COVID to get it over with. You know what I mean? I wouldn't. You never know if you are the unlucky one that reacts very badly to it. And certainly I wouldn't recommend anybody without 3 doses to get COVID. I can have you speak with my with 2 of my nieces, one that had 3 doses and one that had no dose. And I talk with them about how much fun was that, was not. And we were all hugely concerned, right? And it's not because she's an anti-vaxxer, the one that didn't have it, but she's a naturopath and she thinks that, you know, don't put anything in my body that has not been proven for whatever number of years. Well, she did put in her body COVID, which is very unfortunate, right? So it's not as simple as getting it over with, unfortunately.
I'd also like to mention about the grieving process. People have lost a lot of lives in their families, and it's a grieving process for the whole world and the communities that we live in, having COVID, because our lives have changed, what we have lost. And I think even the politicians are going through grieving processes, and what stage of the grieving process people are in. You know, we have to, that is another health teaching aspect of this whole COVID situation as well, is the grieving process around this
So
pandemic.
There was a very good segment, I think, on CBC, and I should try to find it. We should try to find either the segment or the study about the mood on people post-COVID, the overall mood, right? Of overall, I'm not talking particular people, right? That is actually compromised. It's like, and what you said fits right into that, whether it's a colleague, whether it's a friend, whether it's that you just know about it, right? And it's not someone close, or whether it is simply that 2.5 years of this mess is just exhausting, right? It has taken a big toll on people. And I think to that you layer some of what's happening now internationally with the war. It only, you know, there are days I go, what type of world are we leaving to the next generation, right? Yeah, very, very complex. And again, this is a place where RNAO can inject some energy, if nothing else. Energy and space to dialogue, to discuss, to grieve together, and to move together.
Yeah.
Thank you. And C. Camilletti just put in the chat box some information about normal grief and complicated grief and anticipatory grief. So thank you very much for that. There were a couple of questions I just
that would be a really good Camilletti if you are inclined to, and we can also connect you with some other people that might be. It will be a really good webinar. Yeah. Yeah, with tips, right? First of all, again, it's about a bit normalizing that you are not going, you know, that is not abnormal what you're feeling. It's not abnormal to be exhausted of this and to feel, you know, and then when is it that you need to, you know, watch more carefully, and what is it that you can do? I think could be a really good webinar.
Okay, noted. And C. Camilletti, if you're interested in talking about that more, you could just put your email or contact information directly to the hosts and panelists. So a couple of questions. And Ermagine, thank you. You're also keeping track of the chat box. I just want to go back to a concern brought up, I think by Shannon, about a linkage between superbugs and disinfectants. Do we know anything about that? Doris, are you aware of anything about that? That's a concern?
Well,
anything recently?
Overall, we need to be, and this is not new to COVID, right?
Yeah.
Very, very careful with disinfectants. Very, very careful with the, you know, everybody goes before COVID into these soaps that, you know, are, well, it's a disaster, guys. It's a disaster, right? Because we also need to be able to deal with things. And if we start to, so that's another one that we can bring for a webinar with factual information and doing some work on that.
There's a question about the fourth COVID dose. So another about the safety of the vulnerable population. Would it be efficacious for vulnerable people to have a fourth COVID dose? From Martha.
So my answer is yes, but usually, I mean, so places like Israel, they already gave the fourth dose to everybody 60 or 55 and up, something like that. I don't think here that will happen yet, unless this BA2 goes more wild, because probably they're trying, number one, not to just use so many human resources in the vaccination process, but also see if there is a new vaccine coming at some point out, right? And medications, etc. And also they're looking at waiting 8 months in between the last dose and that fourth dose, which in Israel, they didn't wait, right? They did it much, I think they did it at 4 or 5 months. So will we have a fourth dose? My hunch, yes. My hunch is next fall. And my hunch is this will become a yearly thing, the shot, you know? So the first dose will be kind of your annual shot, probably, unless things get worse before, and then they will recommend before.
I asked the pharmacist because I get mine at the Shoppers, and basically they said you can get it every 3 months, and at the most, like if you had to really do it. And for the fourth dose, you have to have a letter from your doctor that says that you're immunocompromised. But there's so many conditions that can make you immunocompromised, like diabetes, and what other, like with diabetes is one of them, and there's other immunosuppressant conditions. But age is a factor as well. And if we're going to loosen the mask mandates in a couple of weeks, up to a month, it's going to be bad again. So I'm assuming summer is going to be the next time we go get another shot.
Yeah, very good, very good. I don't think that right now everybody can get it. I don't think that that's the case. Nor would I think that I would recommend it to everybody. You know what I mean? But if you are immunocompromised or you live with someone immunocompromised, then it's different. I would suggest that it's equally important, the third booster and a mask. The mask is critical, right? I mean, you can have the three shots and still, bring COVID home if you're not careful with the mask and all that, as some of my colleagues and my own dear son knows. My son went for 15 minutes to pick up something from a store, working from home with this stuff, careful, super careful, three shots, and in 15 minutes he got that damn thing. And then they isolated him. He isolated himself, I'm joking. But he isolated himself for 12 days at home because he didn't want anybody else to catch it, and no one else did catch it. So, I mean, the boosters alone will not do the trick, guys. And even the mask alone, because he actually had the KN95. So it's remembered, so many people in the stores do not use the mask, so many. But the more people now are covered by the vaccine, 90%, as you know, we are at 90% with adults, right? Age 12 and up, 90%. And others that have gotten the disease. So at some point, we will be in a better shape. At some point, we will be in a better shape. But
especially if the vaccines reach the rest of the world.
Well, especially if the vaccines reach the rest of the world, although that might happen that the vaccines will not reach, and we will be doing better, and we will have vaccine apartheid, as it has happened with other vaccines, right? Which is terrible, right?
Yeah. So on the topic of vaccines, Naomi is bringing up the issue of future vaccines and the concerns that some people might still have about affecting our genetics. Do you want to say anything about that?
Yeah, so it never was the case, and it never will be the case that the vaccine affects genetics. That was one of the very famous fake news that was put purposefully out. Like, you need to understand that while some people then spread the news naively because they believe on it, and we all know people like that. Those that initiate these pieces do not do that naively, right? And one of my blogs is about that. So I would ask that Raulito, if you can Google Doris blog, vaccine, anti-vaxxers, vaccine hesitancy. There is a big difference between the two, as you know, right? And then there is also between that and the organizers of the track rallies. There is a lot written about this. And the piece that I learned that I did not know and shocked me when I did the research for the blog back then was how much they target specific populations. So our colleagues in the Black community have been targeted historically. First, they were for testing things, right? And my colleagues that are Black know about that. But then they were targeted by anti-vaxxers in purpose because of the fear that was justified in the Black community. They were targeted in purpose with some of these fake news. The other thing is the other side of the coin, how well things can work. And you have the work that this province, Ontario, did with First Nations communities. And they did it engaging the community driving the agenda on how, and they reached, I think, 90 or 95% vaccination rate. It was remarkable. No one ever thought it will be that good. And remember, they also suffered horribly, historically, right, on being guinea pigs for things, or worse than that even, right? So it all also, a lot of it also has to do with right processes to engage people in their own terms, to discern fact from fiction, and to explain and explain and explain and explain again to people. But it is very clear that this mRNA is, was misused, was never related to changing the DNA. So that's not factual. So let's be very clear about that, on the science on that. And there are other vaccines that have been approved, but the reality is that they are not as effective, right, as the mRNAs one. And then there will be a nasal one at some point, I believe. But again, that's all to come. It's too bad that we still don't have a good vaccine for the less than 5 years old. I will sleep better at night when we have that one, because we have 4 grandkids and the younger one still is not vaccinated. Although this year she will, and she can't wait for that. It's fascinating how kids want to be vaccinated, right? It depends a lot on the home and what parents pick, whether it's the mask or the vaccine or the McDonald's or the whatever, right? Depends what the parents pick at home, what the kids believe is good or not good for you, right? The other day, Noah, our 11-year-old became, not 11, what am I talking, 14, became vegetarian. He became vegetarian simply for environmental reasons, not even health reasons. And he's so strong at it. And I don't know what got into my head that I mentioned McDonald's, that McDonald's has veggie burger. And he looks at me horrified and he goes, why would you say McDonald's, Sarti? Like, why would you even speak about McDonald's? I felt so guilty, right? Because all these kids, when they're little, they want the Happy Meal and all of that, the little ones, right? So now McDonald's is out of my vocabulary. Veggie or not veggie, it's gone off my vocabulary. But you know, it all depends where they come from. And kids today are very, 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 very thoughtful and have their own views.
Yeah. Very strong opinions from kids, and it's great to hear them asserting themselves. So just a time check. We've got 20 minutes left, Doris, and I know that when we talked about this webinar, we said, well, let's see how long will, how much dialogue there will be on the pulse check, and then we had this sort of other part that we would talk about initiatives, and maybe we could maybe touch on that a little bit, or just focus on that at another time.
We can touch on the initiatives, and we can also touch on what people want for the next one.
Sure.
So number one, I do think that it will be really important to share with people at some point that it's not as urgent. Well, the most urgent is the platform. Of course, we will not share it today, but the next one really should be about the platform. Not in details, because honestly, we do not need to give all the details, but at least what we are asking under the 5 domains that we are tackling, and then a bit of open dialogue of how people can get involved. And I can chat with policy, on and Irma-Jean is here, on what is it that we want out of that half an hour, no more, Irma-Jean. Okay. So 15 minutes for a presentation, and then 15 minutes of people saying how they can get involved. Second, will be really important to share the InFocus. I think it's a marvelous window and portal for people to know everything that we are doing on areas of priority of RNAO. Are these the only areas we are tackling? No, but are these critical areas where we have put lots of eggs in the basket to have a really good meal that ends up with positive outcomes? Yes, I do a lot of analysis with food, so sorry, guys. So that's another important. So could be that we do half an hour and half an hour. And then the next one after that, and that will give space for some of our colleagues if they want to prepare something, right? We had today one of our colleagues, Camilletti, I think, talking about grieving. Maybe it will be great if you can, with some others, present on this. I think will be marvelous. And what other topics would people like, right? That we can prepare based on, like we have a sizable number now, 85 people, right? What is it that, and guys, put that in the chat and we will take it away. What are topics that you would like to address? And we will be happy to oblige.
Yeah, and the other thing that we said, Doris, too, was super bugs and hand sanitizers.
That will be an amazing one. We will all learn a lot.
We talked about maybe.
You know who can help us with that? Jeff Powick. Remember Jeff from Michael Garron that I was at the beginning, like joined by the hip? Yeah. Jeff will do an amazing piece. Could be Jeff, could be also a nurse from public health, could be a nurse that specializes in infection control. Like we could have an interesting panel. Let's think about that. Multidisciplinary.
Okay. The other thought I had is we're talking about sort of a refresh on the facts and the rationales. I'm hearing that we've kind of lost, like what are maybe some key messages that you can communicate at work or in your communities? So I don't know if that interests anyone, but that kind of came to mind.
Very good.
And then you also said that you might invite some of these science experts that you like to follow on Twitter.
Yeah, I can, but that will take probably some time, or we can do a podcast. Let us think about that, but the platform and the focus, should be next time, because if not, it's after elections, kind of almost.
Yeah.
And people may want to get involved with the chapters and interest groups. And Irma-Jean, if you can put Anne-Marie email in case that people want already to get involved in some of the activities related to elections, they can connect with Anne-Marie. That would be amazing, because we are doing all candidate sessions, we are doing debates based on specific topics, and we can certainly connect with you.
Yes, so please feel free to put any of your other thoughts of topics in the chat box that we might do in coming webinar series. And again, the second Monday afternoon of the month from 2 to 4. And I just want to ask Irma Jean or Heather, I know that you've both been following the chat box, and it's been really like there's been interesting dialogue amongst members of participants today. Irma Jean or Heather, did either of you want to point out anything that you read that stood out for you, or any outstanding questions that you think we haven't had a chance to ask?
I didn't notice any outstanding questions necessarily. I did see a lot of reinforcement amongst the comments back and forth, and people supporting others' comments and offering suggestions for resources, etc. So if you haven't been following the chat, do have a look there. We'll try and capture those in our notes, but by all means, there looks like there's some interesting opportunities that people are suggesting.
Oh, thank you, Susan. I had two comments. One, and this may be for a longer discussion, Elizabeth raised that relationship between response to COVID protocols and faith-based organizations, and how she was quite surprised at somehow the use of one's faith in terms of responding to the protocols. The other was just a thought I had as we started this discussion about how do we really have people continue to embrace appropriate public health measures. How do we change behaviors for good, and then are in focus. And then I just thought of social movement theory and how perhaps a session at one point, Susan, and maybe you're doing this in many other ways, connecting some of this to social movement theory, and how, even things we're doing like Maskathon and these webinars are all part of that, and what more we can do to really help this become our whole way of being around public health, become really a norm that is just how we live.
Thank you for that. Great. Anything else there, Doris? Anything that you're seeing in the chat box that you wanted to reinforce? Or?
No, all good. All good. Lots of agenda items. And if people don't think now, you can think later on, and you can always send, maybe you can put an email to where they need to send them ideas for future events.
Okay.
So,
great. Yeah.
Mission to Ukraine. Well, I actually just spoke with Valerie Repka, who is actually leading the mission to Ukraine. I spoke with her about just before our webinar, minutes before she needed to speak with me. Amazing work they're doing. Well, we have about 15 people there. It all started with, of course, this horrible war, and the fact that people ask, is RNAO involved? And I said, yes, RNAO is already involved in trying to get people out of there, and there will be more coming. And then Corsita Garraway, the co-chair of the Black Nurses Task Force, said, my passport and my visa are ready. And I go, oh, mission. And one thing leads to another. We had already gotten some people through really the hard work of Natalia Kosandova, who had been contacted. She had been contacted by people from Nigeria that needed to get out, students. Many students were stranded. And she worked with the Poland government. She's from Poland originally. So is Valerie Repka, which I had forgotten. But RNAO also supported that effort and invited others to support that effort. And a large contingency is already out of there. Another contingency, we sent some funds simply for them to have food, a group of 35 students that got stranded there. And then when I realized that Valerie also, I asked Valerie if she was doing anything. Valerie used to work at RNAO. She's the founder of CIMAT. And then I thought, okay, maybe Valerie's going there. And Valerie's telling me she's trying to get there, but she does it through WHO and still has not get any approval. And then on the spot, I connected the dots between these people, and the rest is history. In no time, they organize everything. I have never seen something that fast, but I guess this is how missions work, right? And they are going to be working at the border in a mega tent. Well, actually, I should not be sharing this. Dan, I forgot. I'm not supposed to share any details for security reasons. So in any case, they're working very, very hard. Let me leave it there. Putting their expertise, Corsita is a nurse practitioner, Natalie is an RN, Repke is an RN, doctors are there. They have very specific teams that they send that need, actually, they tell you exactly how many of each profession they need and how many on logistics. But follow my tweet because I did tweet a couple of days ago about this, and I will tweet more today. And I will say whatever that they allow me to say. I'm sure that when they're back, they will tell you more. Amazing work, doing a lot of good work. Yesterday, they met with a group of the students that we were able to help. I hope that one day you will get the opportunity to hear them directly, because it gives you goosebumps. Because the day after some of them left, their entire building was bombed. So they would not be out, you know what I mean? And they did a full assessment yesterday on all the group. And of course, not all of them were vaccinated. So today they were doing vaccinations, etc. But that's the easy piece. That's the piece of primary care. The more complex piece is coming in the next few days. Yeah. And then a second group will be going to. So if you are inclined to support in any way or shape, whether it's $10, $15, no dollars or more dollars, please go to our website. There is a site for donation. You do need to know that while CIMAT covers the expenses on the ground, all the tickets, they need to cover themselves. And that's legally what these organizations need to do, so that, you know, if you are inclined, please do that. And you can put you can put at the bottom for whom, you can put for nurses, you can put for RNAO members, and you can put nothing, and it will be used for whatever they see fit. It's up to you.
Mm-hmm.
Great, thank you, Doris. I just put the link there. I think that should be a link there about the mission. Oh, Renee put that in. Thank you, Renee. So with the last few minutes, Doris, I was thinking that maybe what we could do is just get people to reflect on what they think the key messages, take-home messages of today's topic were, that they might want to share with you know, friends or colleagues. How does that sound?
Excellent.
Yeah, you could unmute your line or put that in the chat. I'm just kind of curious. We've talked about a lot of things as we look at where we're at right now with the pandemic and province opening up, and a lot of apprehension from and real valid concerns from people on the line. So if you were to, you know, have one or two messages that you would want to share with colleagues or loved ones about what we've talked about today, what might those be? Oh, and two participants raised their hand. Let me see. So, sorry, I'm having clicking. I'm not able to click for some reason on that. Can I ask Olivia, maybe someone else can allow people to speak? For some reason, I'm not able to see.
I think I gave Martha, you can unmute.
Hi, thanks, Olivia.
No problem. Thanks.
I think One key message would be that I think public health, I mean, not public health, it's just public health, but the Science Council, the Public Health Agency of Canada, RNAO, and other organizations in Ontario and in other parts of Canada as well, have, I think, done a very good job for our first major pandemic. Things did get off to a slow start as this new virus was evolving. But in the end, I think that a lot of good work was done to help prevent deaths and serious illness. It's not fun, even one death is too many, but I think our total number of deaths for Canada is around 38,000. I don't know if I'm correct, but compared to other countries, we have managed to get higher vaccination rates. We have managed to educate people to a certain extent about the public health measures like masks and vaccinations and sanitary liquids, etc. So I think one message should be a positive one, that it went well in some respects, but there's still a lot of work to do. And I liked Susan's idea about having a refresh on facts and rationale and how we would communicate that, especially to populations that are resistant. So that's, and thank you very much for holding this webinar. It was very helpful.
Martha, I think your point that we need to also look at the 3/4 full of the cup, even though, as you said, one life is too many, is true, because Canada overall, comparatively speaking, I think the only downfall that we really had, and it was more than in some other countries, was the issue with the trackers at the end. With all without that, we would have been, you know, in terms of our success story, yes, tragedy, but also success story of how we kept together, right? That just stole it from us. But I think we need to block it in the closet and leave it in the closet and never happen again.
Right.
And I think you are completely right that all in all, comparatively speaking to other countries, I mean, look south of the border, right? Yeah. Thank you for that.
Martha. And Francis?
Yes.
I think
I have not been able to access this really well, but I just want to say that I appreciate this. It is a very worthwhile thing to do for the whole community and for nursing community. I cannot say how much I appreciate this. I am a nurse now who focuses on dementia care. I do relief care for partners who just want to go out for a few minutes from their loved ones who has dementia and or Alzheimer's. And the pandemic has affected me too in many ways. But I just want to say that I appreciate this, because I have had to fight with people on the subways, on the buses, and I just tell them, I said, even if you don't want to mask for yourself, I said, I work with the vulnerable, I work with elderly people, and I need to go to their work, I need to go to their homes with a good conscience, knowing that I did not come across anyone without COVID, and I do not know, I cannot know for sure, but if people are wearing masks, at least I can say, you know, I am protecting my clients. So thanks again.
Thank you so
That's
much,
beautiful.
Francis.
Okay.
Great. So thank you everyone so much for this excellent dialogue, thoughtful dialogue, support for one another, and your excellent questions. And this is actually our 33rd COVID-19 webinar. And we're not done yet, it looks like, unfortunately.
I don't know if we will ever be done. No, not with COVID, yes, but you know what I mean? Then there are other topics.
Yeah.
Silver linings of COVID.
Right, right. So Olivia, to your question today, yes, let's keep scheduling. And thank you for all the suggestions for future webinars. So the next one will be the second Monday of April, which I don't have my calendar in front of me.
I believe it's April 11th.
Thanks, Olivia.
No problem.
All right, so it's 3:59. Doris, any last comments that you'd like to say to finish the day?
No, thanks to Olivia, to you, Susan, to Imagine, to Heather, to the team for putting this together. And just a privilege to hear our colleagues so active in asking questions, making comments, providing suggestions. Just a real pleasure to be together. A total pleasure. Thank you.
Thank you.
Thank you.
Thank you, everyone.
Thank you.
Bye-bye.
Bye-bye.
Bye.